We've all had that annoying tickle in the throat, the kind that sneaks up on you when you least expect it, making you clear your throat or cough just to get some relief. That little irritation can quickly turn into a cough, sometimes dry and scratchy, other times deep and persistent. Usually it's just a cold or the flu, and after a week or two, it fades away as your body fights off the infection. You start to feel better, and life goes back to normal. But what if that cough doesn't leave? What if, instead of fading, it sticks around, showing up day after day? What if it lingers for weeks or even months, making you wonder if something else is going on? It can be frustrating, even worrying, especially when you're not sure what's causing it. For those over 65, a persistent cough isn't just a nuisance, it's a signal that something more serious could be going on. It's your body's way of telling you to pay attention. Our immune systems change as we age, making us more vulnerable to health issues. The body's defenses aren't as strong as they once were, so it's easier for infections or other problems to take hold. Ignoring a chronic cough could mean missing an important warning from your body. Sometimes what seems like a minor annoyance is actually a sign of a bigger health issue that needs attention. In this video, we'll explore why coughs linger, what they might mean for older adults, and how to take action. We'll help you understand when it's time to see a doctor and what questions to ask. We'll look at the most common causes, from lung and heart issues to medication side effects, and discuss how lifestyle changes and early intervention can make a real difference. Our goal is to help you become an informed, proactive partner in your own healthcare, so you can breathe easier, feel better, and stay healthy for years to come. Most of us assume a cough is just another cold, but after 65, things change. A cough that lasts more than 2 months isn't normal for a simple virus. If your cough lingers well beyond the usual week or two, your body is telling you something else is wrong. Think of a cough as your body's alarm system. If it keeps ringing, the problem isn't fixed. The cause could be environmental, related to another organ, or a new lung issue. Treating it like a cold is just hitting snooze on a real warning. The key is to shift from waiting it out to actively investigating the cause. Ask yourself, what else could be causing this? Has anything else changed? Early action can make a big difference in your health and quality of life. When someone comes in with a cough that just won't quit, doctors usually start by looking for 3 main culprits. These are the most common reasons behind a chronic cough, and surprisingly, none of them are the common cold. While a cold can cause a cough, it rarely lingers for weeks. So, if your cough is hanging around, it's time to consider other possibilities. The first big cause is GERD, or acid reflux. This happens when stomach acid sneaks up into your esophagus, irritating your throat and triggering a cough. Many people think acid reflux always comes with heartburn, but that's not always true. Sometimes, a cough is the only sign. The second major cause is post-nasal drip. This is when excess mucus from allergies, sinus infections, or even changes in the weather drips down the back of your throat. It can create a constant tickle, making you cough, especially at night when you're lying down. The third is asthma. While many people think of wheezing or shortness of breath, in older adults, asthma can show up as a dry, nagging cough. Sometimes that cough is the only symptom, and it can start later in life, even if you've never had asthma before. These 3, GERD, postnasal drip, and asthma, are responsible for most cases of chronic cough in adults. They can overlap, too, making diagnosis a bit tricky. That's why your doctor will ask detailed questions about your symptoms, like whether you have heartburn, allergies, or any trouble breathing. They may also ask about when your cough is worst, and if anything seems to trigger it. The good news is that all 3 causes are treatable. With the right diagnosis, you can get targeted treatment and finally find relief from that stubborn cough. Identifying the true cause is the first and most important step toward feeling better. Sometimes it takes a bit of detective work, but it's worth it. And remember, don't rule out asthma just because you've never had it before. It can develop at any age, and it's often overlooked in older adults. If your cough has lasted for weeks, it's time to look beyond the usual suspects like a cold or flu. Chronic cough deserves a closer look. Relief starts with the right diagnosis, and with your doctor's help, you can get back to feeling like yourself again. Did you know that some chronic coughs can actually be caused by the very medications meant to keep your heart healthy? One of the most common culprits is a class of drugs called ACE inhibitors, which are widely prescribed to help control high blood pressure and protect the heart after certain conditions. These medications are effective, but they can sometimes come with an unexpected side effect, a persistent cough. In fact, up to 20% of people taking ACE inhibitors develop a dry, hacking cough. This cough can appear weeks or even months after starting the medication, making it tricky to connect the dots. It's usually not dangerous, but it can be annoying and disruptive to daily life, especially if it keeps you up at night or interferes with conversations. If you're on an ACE inhibitor and notice a new persistent cough, don't ignore it. Bring it up with your doctor at your next appointment or sooner if it's bothering you. Your healthcare provider can help determine if your medication is the cause. It's important not to stop taking your medication on your own, even if the cough is bothersome. Stopping suddenly can put your heart at risk, so always consult your doctor before making any changes. The good news is, your doctor can often switch you to a different blood pressure medication that doesn't cause coughing. Most people find that the cough fades away once the medication is changed. But coughs aren't always about medication. Sometimes they're a sign of something more serious, like heart failure. In heart failure, the heart can't pump blood as efficiently as it should. This causes fluid to back up in the lungs, leading to a wet, sometimes gurgling cough. This type of cough often gets worse when you lie down, making it hard to sleep or rest comfortably. You might also notice other symptoms like shortness of breath, feeling unusually tired, or swelling in your legs and ankles. These are all signs that your heart isn't keeping up with your body's needs. If you experience these symptoms, especially if they come on suddenly or get worse, it's a red flag that needs immediate medical attention. Don't wait. Seek help right away. Managing heart failure is essential, not just for your lungs, but for your overall well-being. With the right treatment, many people can control their symptoms and improve their quality of life. So, if you have heart issues and notice a new or worsening cough, don't brush it off. Talk to your doctor. It could be the key to protecting your heart and your health. Allergies aren't just for kids. They can develop at any age and often show up as a chronic cough in older adults. You might not have sneezing or itchy eyes. Instead, your cough is the main symptom. Inhaling allergens like dust, pollen, or pet dander triggers inflammation and extra mucus, leading to postnasal drip and coughing. The cough may be worse in the morning or in certain environments. Reducing exposure is key. Use air purifiers, wash bedding often, and keep windows closed during high pollen times. Medications like antihistamines or nasal sprays can help. For some, allergy shots may be an option. Remember, you don't have to live with an allergy-related cough. Identifying and managing triggers can bring real relief. Talk to your doctor about the best strategy for you. Some cough symptoms are urgent red flags. Coughing up blood, even a little, always needs immediate attention. Unexplained weight loss or drenching night sweats with a cough can signal serious conditions like infection or cancer. Shortness of breath, wheezing, or chest pain are also warning signs, especially if they come on suddenly or worsen with activity. If your cough changes in sound, frequency, or is joined by new hoarseness, see your doctor. Smokers should be especially alert to changes in their cough. These symptoms are your body's way of saying something serious may be wrong. Don't wait. Get checked right away. While you and your doctor search for answers, there are ways to ease your cough at home. Stay hydrated. Water and herbal teas thin mucus and soothe your throat. Use a humidifier to add moisture to dry air. especially in winter. Prop up your head at night to reduce postnasal drip and reflux. Avoid smoke, strong scents, and other irritants. Soothe your throat with sugar-free lozenges or a spoonful of honey. Remember, these are comfort measures, not cures. Always check with your doctor before trying new remedies or over-the-counter medicines. Self-diagnosing a chronic cough is tough. Many causes overlap. You might treat allergies when the real issue is acid reflux, or vice versa. That's why seeing a healthcare professional is essential. Your doctor will ask detailed questions, review your history, and do a physical exam. Tests like chest x-rays or breathing tests may be needed to pinpoint the cause. Each test is a clue, helping your doctor build a clear picture. With the right diagnosis, you'll get a targeted treatment plan. Don't guess. Get expert help for lasting relief. Your health is your greatest asset, especially as you age. A chronic cough is a signal. Don't ignore it. By understanding the causes and seeking help, you're taking control of your well-being. Be proactive. Listen to your body, share details with your doctor, and ask questions. Each cause we've discussed needs a specific approach. Diagnosis is key. Addressing your cough means investing in your quality of life. Imagine sleeping soundly and enjoying conversations without interruption. Take charge, seek answers, and breathe easier for a healthier, happier future.